Some doctors started to ask, what is the effect of high-intensity interval training and/or strength training on inflammation, oxygen levels, and blood sugar parameters in individuals with type 1 diabetes? A study was done titled Glycemic, Inflammatory, and Oxidative Stress Responses to Different High-Intensity Training Protocols in Type 1 Diabetes. Treatment groups were split into strength training, high-intensity training, and both programs. The strength training group did 3 sets of 15 of their maximum weight with good technique, lasting 40 minutes. The second, HIIT trainers, did 10 bouts of 60-second cycles on a bike for 25 minutes. The third and final group did both of the protocols for a total of 65 minutes. After 10 weeks of treatment, the study showed that the high-intensity protocols, Group 2 and 3, improved the sugar in their blood and their antioxidant levels. How exciting! As a physical therapist, we may advise some of our patients to follow HIIT and strength programs, depending on their personal situations, to hopefully benefit their insulin dosing. Awesome, right? Now, let's see how HIIT can affect vascular function and overall fitness. Luckily for us, someone did a study to do just that. The study consisted of 27 participants split into 3 groups of 9 and compared their vascular function. There was a HIIT group, a moderate intensity continuous training group, and a control group. The study showed that HIIT significantly improved blood flow and physical fitness compared to groups 2 and 3. HIIT kept blood sugars low, causing less buildup in the veins. HIIT can keep blood pressure low, heart rate low, which is important for type 1 diabetes because they're at higher risk of developing other cardiovascular systems. So in conclusion, we can see that these effects lower the risk of type 1 diabetes mellitus patients getting other cardiovascular diseases. But if the true problem is at the pancreas, what if we created our own? Let's take a look at this study called Home Use of a Bihormonal Bionic Pancreas versus Insulin Pump Therapy in Adults with Type 1 Diabetes. It included adults with type 1 diabetes living at home. It compared a bihormonal bionic artificial pancreas to the insulin pump. In the end, we saw that the artificial pancreas was better than the insulin pump in terms of regulation of blood sugar, less need to carbohydrate count, less measurements the patient needed, less insulin dosage needed. It only utilized patient's body mass and was overall easier for the patient than the efforts of an insulin pump. We can conclude from this study that the bihormonal bionic pancreas automatically adapted to the changes. It was better than the current treatment that was being used, and it opens the doors to many more studies and research that can be done.